So I'm with the Canadian Labour Congress and want to welcome you today, this Monday evening, to our third evening session. I'll be moderating the panel. And first of all, I'd like to begin by acknowledging that this meeting is taking place on Indigenous lands throughout British Columbia. I'm on unceded territory of the Musqueam, Tsleil-Waututh, and the Squamish peoples, and we thank them for allowing us to be part of their lands, but also to learn lots of lessons from what's happened in the past and what will happen in the future. So today's hot topic is the opioid crisis and what Labour can do to help, which is an extremely important topic that we've been dealing with for a while, but the crisis is even more severe at the moment. We have an excellent panel here tonight that'll be presenting to you over the next 30 minutes or so, and then we'll go to Q&A. But let me just run through the evening for you. At the beginning, we'll have CLC Vice President Larry Russo, who will introduce the topic for tonight's discussion. Larry's in Ottawa, so he's 3 hours ahead of us and still awake and ready to go. We have really a great panel tonight. We have the Honorable Sheila Malcolmson, Minister of Mental Health and Addictions. Congratulations on your re-election, Sheila, and your appointment to Cabinet. And as well, we have Harwinder Sandhu, which is the newly star MLA for Vernon Monashee. That was just a wonderful win for our party in that election. Excuse me a sec here. Following our political leaders, we'll have Vicki Waldron, Executive Director of the Construction Rehabilitation Plan, to give the Labour perspective on this, and then we'll go to Q&A. Q&A will be very simple. There is at the bottom of your screen there a Q&A icon. Just sign into that and you can write your questions out, and we'll be asking the questions through me to our panelists, and they'll have an opportunity to answer. We can usually get in quite a few questions if you keep your questions relatively short, but we will read it out on your behalf. So that's it. Let's just get started with the evening and start with the CLC's Vice President, Larry Russo. Larry, welcome back to British Columbia.
Well, thank you. It's great to be back. Unfortunately, can't be in Harrison this year, but it would be much nicer. We get challenges in life and we rise to them. So welcome everyone to winter school, and I'd like to thank the entire team that's putting on this school this year in a virtual setting. So thank you very much for having me. And yes, we're going to talk about the health crisis. You know, we've got the pandemic going on, but what tends to get lost in the coverage, of course, is the opioid crisis that is still raging among us. And it's such an important topic for us to be discussing this evening. So a couple of stats just to bring this to the fore and center. In November 2020, 153 deaths where illicit drug use was suspected in British Columbia. And that is practically a 90% increase over the same month in 2019, the year before. So in 2020, 70% of those dying from opioid overuse were aged 30 to 59. So people in the prime of their life, and 81% of the victims are men. And these are working people, members of our movement, and the crisis is happening in parallel with the COVID pandemic. So it slows the progress on tackling the opioid crisis, and in some ways, in many ways, it's making things a lot worse. So officials have said that COVID-19 has interrupted the supply of street drugs from manufacturers in other countries, which means that the local dealers are making their own product, which is exacerbating to no end the problem. Of course, it's resulting in changes to potency meaning users don't even know what they're taking. And in an effort to follow physical distancing and because of the pandemic, a lot of people are using alone as well. So Dr. Bonnie Henry's public health order in September allowed registered and psychiatric nurses to prescribe safer drugs as an alternative to street drugs. And this is the sensible, it's the compassionate, and it's the right thing to do for public health. This is the correct public policy, and it is a practice that other provinces should copy as well. So we know that the crisis is affecting workers, including members of our movement. And for workers, especially in the construction trades, the hard physical nature of the work takes a toll on the body. We know that the cyclical nature of the work, along with the fact that many workers in construction don't get paid if they don't go to work, it means that people are seeking remedies that will allow them to work through pain. And for some working in remote locations away from their loved ones, loneliness and isolation only contributes to the problematic substance use and abuse. So we know that when employers don't adequately invest in prevention to ensure that workers don't experience injuries and chronic pain, and that also contributes to the opioid epidemic. And then when our compensation systems push injured workers back to work before they're ready, creating barriers to accessing non-pharmaceutical supports for recovery, that contributes to the opioid crisis. So we're seeing these systemic issues that are involved here. And a lot of us know people who get injured at work, and how it ultimately can destroy one's life. People losing their family, their jobs, and tragically their lives. So in addition to preventing injury and ensuring that injured workers are properly supported in their return to work journey, and this is so important, we know we have to reduce the stigma for people who use drugs. And this will help reduce the shame, the isolation, and it prevents people, which prevents people from seeking help. We need absolutely better access to support and treatment, and we need to prioritize the harm reduction approach to substance use. And so while British Columbia, you folks have, supported much of the brunt of the opioid crisis in Canada, you have also put in place many of the building blocks that are necessary to tackle the problem. You have a government that recognizes that this is a public health emergency. That is the number one thing that needs to be recognized by governments across Canada. We are looking at you. We are seeing that your practices can constitute a model for what we can do across the country. Your government includes a minister responsible for mental health and addictions, like yay. And the government strategy released last year commits to an approach to mental health and addictions care that is based on prevention, seamless and integrated care, equitable access to culturally safe and effective care, as well as Indigenous health and wellness. You have as committed trade unionists engaged in our labor movement, okay, with the building trades leading the way for the members. You're going to hear more this evening about the BC Construction Industry Rehabilitation Plan, which is a joint labor management project. It's something that we're following very closely and that we have a lot of hope for. And we know that these are the kinds of steps that need to be taken to come to grips with this crisis. And unfortunately, as I said at the opening, it's unfortunate that this crisis is being eclipsed by the wider pandemic, but we need to talk about it. We need to get it out there, and we need to make sure that our members are ready to support the important steps that not only labor is taking, but that government is taking and that employers are taking in collaboration. So thank you all for participating this evening, and I look forward to hearing the feedback, and I wish you all a good learning session for those of you who are going to be involved in learning this week. Thank you very much, and have a great evening. Take care.
Thank you, Larry. Thank you very, very much. Now we'll turn it over to a couple of really super politicians that we have here. So I will introduce Sheila Malcolmson, the Honorable Sheila Malcolmson, the Minister in charge of this file. Over to you first, Sheila, and then to Harwinder after that. I'm not sure how you guys are setting up your time, but it's all yours now.
Thank you so much. I'm joining you tonight from Snuneymuxw First Nations territory. Thank you to CLC for including me and for finding a new way to deliver winter school despite the pandemic. This is one of the most important events on the labor calendar where we share knowledge and learn from each other. I've benefited from the teachings at Harrison, and I'm especially grateful to keep connected. Over this past year, a lot of us have found a new appreciation for the value of connection, for our work, our activism, most of all, well-being of ourselves and our loved ones. And virtual events like this help maintaining that connection and getting us through a really challenging time. Well, challenging is an understatement. The uncertainty of this moment, the loss of routine, the isolation, heightens anxiety, depression, grief, and stress. And for many people, it's much harder than that. People who've lost their jobs, whose work is precarious, whose hours have been cut back, people working overtime on the front lines, facing potential exposure to COVID, and people already dealing with mental health issues magnified by the pandemic. So let's talk about addressing that toll in the workplace during COVID and beyond. Early in the pandemic, we saw an increase in demand for mental health services, and it hasn't slowed. More and more people are reaching out for help. But prior to the pandemic, the overwhelming majority of the mental health care in BC had been delivered face-to-face. The last thing we wanted to do was cut people off from the help they needed at the moment that they needed it the most. So we had to move mental health services to the virtual space overnight. We supported one of the fastest mental health transitions BC's ever seen with a $5 million investment in virtual delivery. And that investment has helped support youth, seniors, frontline workers, all British Columbians at home and at work. There's more coming. BC's economic recovery plan includes supports for more virtual mental health services. And in March, you'll see a new online platform to help workers manage stress and anxiety and build resilience. In May, we expect to have a Made in BC virtual training and education program out to meet the needs of hardest hit sectors like tourism, hospitality, and community social services. So workers and employers will get the tools and resources to improve psychological health and safety. And it won't be one size fits all. The mental health challenges people face are as diverse as our province and our communities. And the services and supports we offer must be just as diverse. We also recognize, as Larry has so powerfully outlined, COVID is just one of two public health emergencies British Columbians are facing. Second is the opioid poisoning crisis. And that overdose crisis has hit some sectors much harder than others, construction, trades, and transportation particularly. Workers in these sectors are disproportionately affected by workplace injuries that can result in chronic pain. And as the labor movement knows well, many people's journey of addiction began with an injury any of us could experience, such as a workplace injury or a car crash, where opioids were prescribed to manage the pain. Premier Horgan has asked me and Labour Minister Harry Bains to fill gaps in the current system of care for those living with chronic pain. And our work includes ensuring that collective efforts to address chronic pain align with the overdose crisis response. And I want to work with and learn from the labor movement on this. Nearly 5 years ago, BC declared the overdose crisis a public health emergency, and that pandemic has been particularly hard on people who use drugs and on their families. Drugs are more toxic than ever. People are more isolated than ever. Many are using alone, mostly in their own homes. And these are daughters, sons, parents, neighbors, friends, co-workers. They're people we know, they're people we care about. And many struggle alone in silence because of the stigma that surrounds addiction and mental health challenges. That stigma stops people from reaching out for help and drives them to use alone, and using alone means dying alone. So it's imperative that we send this message, no matter what your challenges, no matter how you're coping with them, no matter how dark things seem, you're not alone. We're reaching out to employers to create safe spaces for workers to talk about mental health and substance use challenges without repercussions. We can't let there be any doubt or ambiguity about this. Substance use is a health issue and should be treated as any other. Reducing stigma will save lives. So will ensuring people have safe alternatives to an increasingly toxic drug supply. One of the most insidious impacts of the pandemic has been a disruption in the supply chain for illicit drugs. And now the illicit drug supply is dramatically more toxic than a year ago and tragically more lethal. We've worked with the BC Centre on Substance Use to give more people access to safe prescription alternatives to the increasingly toxic drug supply. And we're adding nurses to the list of professionals who can prescribe these alternatives. And last summer, Premier Horgan asked Ottawa to decriminalize possession of illicit drugs for personal use. That's to combat stigma. We're also expanding harm reduction efforts, adding more treatment and recovery beds, and bolstering supportive recovery. We won't turn this crisis back by focusing only on one solution. And we won't succeed without the participation of our whole community, our whole province. And that's the key, not just to bringing the opioid crisis to an end or turning the page on COVID, but the key to transforming mental health in British Columbia. We need to involve everyone. We need to act everywhere. And workplaces are no exception, far from it. Right now, only 1 in 4 Canadian workers feel comfortable even talking to their employer about psychological health issues. That has to change. And change is happening. 5 years ago, my industry didn't even exist. Struggling with mental health and addiction challenges had few. So we've moved quickly to reinvent our system of care, work for everyone, and meet people where they are at. And we're taking a truly whole of government approach. Many of the mandate letters for cabinet prioritize mental health and addiction. But the need is greater than ever, and we still have so more to do. Our goal is an ambitious one, a system of mental health and addictions care that works for everyone, no matter where you live, what you make, what issues you're facing.
I think we have a little tech difficulty here with the minister's line. So Harwinder, how about you jumping in now? And I'm sure Sheila will reconnect in a couple of minutes.
Yes, definitely. I would like to say good evening to everyone joining in. And I'm virtually joining you today from the unceded territory of the Okanagan Indian Nations. I'm joining you from Vernon, BC. I would like to thank the Canadian Labour Congress Winter School organizers for the invite and for giving me the opportunity to share my thoughts with all of you. Thank you for joining in. Thank you, Ron, for your kind comments. I am thrilled to be a part of the government who actually understands the importance of healthcare, mental health, and many other vital services that we all rely on. I will speak to and highlight few of the important actions that were taken by our BC NDP government to address mental health support in workplace. And I personally have witnessed the positive impacts of these measures during my work in healthcare as a registered nurse in both acute care and community care settings. So some of the highlights, the work that was done around mental health support in workplace, and then some work was done with WorkSafe BC and pain management, again, paid sick leave, systemic discrimination in the workplace. So to address mental health in workplace, Ministry of Labor took these actions. In 2018, Ministry of Labor made it easier for emergency responders to access workers' compensation for mental health disorders caused by their work. First responders who experience trauma on the job and are diagnosed with mental disorder should not have the added stress of having to prove their disorder is work-related to receive support and compensation. And these first responders are firefighters, police officers, and emergency medical assistants, sheriffs, and correctional officers. In 2019, we've expanded that recognition to include nurses, emergency dispatchers, and publicly funded healthcare aides. And for being a nurse, I know it was a pretty good step that, because as nurses and other healthcare workers, we much appreciated the inclusion into this. This means certain professions which are more likely to experience work-related trauma on the job can get help without the added delay or anxiety of proving that the diagnosis is directly related to work. And then these changes are about fairness and compassion for workers who have served British Columbians and whose jobs put them more at risk of developing mental health illnesses because of exposure, or I would say ongoing repetitive exposure to trauma. Government's move to include nurses in the list of occupations that have the presumption of workplace mental injury is a huge step forward for the health and well-being of all nurses. In recent years, there have been growing awareness of the seriousness of impact on mental health in workplace. And then also WorkSafe BC has programs to support and supports available to injured workers struggling with their mental health. And these supports include like workers with accepted claims for a psychological injury, workers awaiting decision on mental health disorder claims, and workers who are experiencing psychological symptoms because of physical injury. WorkSafe BC can provide support to worker in crisis as soon as a need has been identified and has supports which can be accessed for workers in crisis or workers in need of support while they await a decision on a mental disorder claim. For example, this could include immediate referral to mental health specialist if there is any indication of suicidal thoughts, 24/7 access to telephone crisis line, referral to community social worker, and supportive counseling. Everything is available and can be accessed now. WorkSafe BC has a provide wide network of health and mental health professionals to support injured workers with psychological assessment, treatment, and recovery. They also have specialized claims teams with multidisciplinary team members, including case managers, vocational rehabilitation consultants, psychologists, mental health specialists, and medical advisors. So a wholesome team is there to support injured workers with psychological injuries. And all these supports never existed before these actions were taken, or we can say they existed, but employees had to go through so many hurdles before they could access these services. And the other work was done, WorkSafe BC and pain management. So one of the government's priority is to develop options for chronic work-related pain, including pain management for injured workers. And Minister Malcolmson will be working collaboratively, as she mentioned, with Minister Bays and WorkSafe BC on this. And this includes improving pain management practices for injured workers and providing treatment on demand to those with chronic pain as a result of workplace injury. They will be looking at the system to generate new options to ensure that injured workers have medical care and pain management that they need, while also helping to reduce possibility of addictions. And working in healthcare, I can attest to that how many people developed addictions because their use of the ongoing opioid that they needed to tackle their pain. And WorkSafe BC also has taken actions to reduce risk of harm to injured workers from opioid use that focuses on preventing injuries and disabilities from happening in the first place, which prevention is always the key. And then they support injured workers who are struggling with opioid addictions. For example, one example of that is not just a prescription pad approach, which it's been a great approach to manage for pain management. So essentially an educational effort launched by WorkSafe BC to ensure that safe prescribing of opioids, providing an overview of tapering strategies and substitutions and exit strategies. In addition to all that, last year we made improvements, or our government, BC NDP government made improvements to the Workers' Compensation Act, Bill 23, to better support injured workers and their families. One of the changes allow WorkSafe BC to provide preventative medical treatment before a claim on workplace injury is accepted. Expediting healthcare for workers before claim is accepted, when treatment will likely prevent significant deterioration in health, will make a huge difference in people's lives, especially when it comes to pain management or mental health. The other great deal of work is done and a lot of work is underway is around the paid sick leave. So COVID-19 pandemic is having unprecedented impact on BC's workplace for both workers and employers. And a big part of that is making sure people stay home from work when they're sick. Premier Horgan engaged with the federal government to create a national paid sick leave program, which is leading to the creation of Canada Recovery Sickness Benefit, and which provides $500 a week for up to 2 weeks for COVID-19. In Canada, Recovery Sickness Benefit works with changes we made to the Employment Standards Act, which protects the jobs of workers who take leave due to circumstances related to COVID-19. More needs to be done as this is just the beginning. So if we have, a solid sickness plan or benefits in place, then people can be supported to stay home from work that when they're sick, so they don't have to worry to pay their bills and feed their families. COVID-19 has clearly demonstrated the need. And our Honorable Minister Harry Baines, Minister of Labor, has in his mandate a commitment to continue working with the federal government on paid sick leave program. We are raising concerns. We are hearing about gaps in the program with the federal government, and we will work with them on potential solutions, including solutions beyond the COVID-19 pandemic. It is in all our best interest to have paid sick leave program that ensures all Canadians have the protection and support that they need to stay home when sick. And the other highlight I would like to mention, systemic discrimination in workplace. Workplace harassment and bullying, as we all know that everyone should expect a respectful working environment and know that workplace discrimination or bullying is unacceptable. Workplace bullying and harassment can take many forms, including verbal aggression, personal attacks, and other intimidating or humiliating behaviors, and have far-reaching impacts on workers' health and safety, leading to then absenteeism, lost productivity, depression, and anxiety, and so on and so forth. All of us can do a better job understanding what are rights and knowing when to speak up and where to turn for help. All employers in BC now are required to have policies and procedures in place to address bullying and harassment in workplace. If employer does not take appropriate steps to address a complaint, I encourage workers to contact WorkSafe BC. Discrimination in workplace, everyone has a right to a workplace that is free of discrimination. This is the right that is protected under Human Rights Code. We are committed to promoting respectful, equitable approaches for all British Columbians And this principle is embedded in all our mandate letters. Addressing systemic discrimination in workplace through pay transparency legislation, I will touch a little bit upon that. Again, Minister Banks and Parliamentary Secretary for Gender Equity, Grace Lohr, will be working to address systemic discrimination in workplace through pay transparency legislation. Ensuring equal pay for equal work is something we aim to address. And it's also something that's so near and dear to me as well. In looking at legislation, we will need to make sure it works for BC. And in BC, for example, 98% of businesses are small business with under 50 employees. Currently, pay equity issues in this province are addressed through BC's Human Rights Code. There is much more to do. And as a healthcare professional, I am happy and assured we have a government who's constantly striving and looking forward to strengthen our vital public services like healthcare, mental health, and many more services we all heavily rely on. I'm so proud and happy to be a part of our government where I can openly share my feedback and ideas from my experiences in healthcare. I would say thank you once again to the Canadian Labour Congress Winter School organizing and virtually organizing this winter school again, and for giving me the opportunity to join this session. Thank you everyone who's at the front lines and all our healthcare workers, essential workers, for putting yourself in harm's way to save lives, to make difference. You have been doing tireless amount of work and it's not unnoticed. Kudos to all of you, because it's over a year that the sacrifices you're making. And I would say, take care and stay safe. Thank you so much again.
Thank you very much. And you did indicate we're virtual, we are, and that's why, unfortunately, Minister, you were interrupted there by a little bit of a glitch. But I'd like to pass it over to you for some closing comments before we move on to Vicky. And we have a lot of questions that have come in from folks that are on the line. We're not on the line, but on the Zoom. So go ahead, Minister.
I think I cut out two sentences before I intended to finish, which is to say, we're going to do this work together. A lot of our actions and the successes we've had have been based on the hard work the labor movement has done to get protections for workers, and that's the foundation that we're carrying forward on. You all deserve a safe workplace, and we're determined to do that work together. And again, just deep gratitude for the opportunity to dialogue tonight.
Thank you. Now I'll turn it over to Vicky Waldron. Vicky, on labor's perspective here, off you go.
Thank you. I've got a presentation for you guys here. Okay, so I'll start by saying thank you. I'm really happy to be here, and I'm joining you from the Coast Salish territories, and I'm from Maple Ridge here. So I'm going to be talking to you today about just about mental health and substance use as we are, and just a bit of a primer and a bit of a background. So as the previous panelists have already spoken to, we're currently in the midst of not one but two pandemics. We're in the middle of the opioid epidemic that's been raging for 4 years, coming on to 5 years. And across the globe, of course, we've got COVID-19 and coronavirus as well. So I'll start with the opioid epidemic. It's an epidemic that's, just a brief recap, it's landed on our doorsteps way before COVID did. We were already dealing with this pandemic when COVID hit us. It's been raging, as I said, for 4 years. We've had a public health emergency that was declared in British Columbia in 2016. Since the opioid epidemic it was first declared an epidemic, we've lost 16,364 Canadians, and over that much now, I believe, to the epidemic. Just between January and March, there were about 5,000 hospitalizations from overdoses. That's just 3 months, just 12 weeks, we had over 5,000 hospitalizations from overdoses. Data across Canada is showing that about 75% of those folk that are dying are within the epidemic is men. 89% of those folk are, those men are aged between 20 and 59 years old. And fentanyl, which is a substance that I think we're all quite familiar with now. It's I remember I've been in this business for a long time in healthcare, and specifically mental health and substance use. I've been in this area for almost 20 years now. And prior to 2016, I can tell you that nobody really knew what fentanyl was. I can tell you as a clinician, we never saw anybody that had an addiction to fentanyl, but that's all changed now. So about 77% of all overdoses involved fentanyl, fatal overdoses involved fentanyl. Within BC, we've lost almost 7,000 people to the opioid epidemic. And again, 80% were male. 85% of those people that died, actually, that the overdoses occurred inside of people's residences, inside of homes. And I think there's often a misconception amongst British Columbians, amongst Canadians actually, that the folk that are dying are actually the folk that we see in the downtown east side. And there's this perception that it's the person that's in Pigeon Park or in on the corner of Hastings and Main and Hastings. But actually, that's not what we're finding. What we actually know is that it's actually people that are housed, and more than likely they're probably working as well. Really, in a nutshell, what I'm really saying here is it's people that look like you and I. So it's just regular folk that look like you and look like me. So as we talk about the opioid epidemic, one of the things that we really want to talk about is the link that seems to be that more and more evidence is now showing that there is a link between the construction industry and the opioid epidemic. And this there exists this link, and it's a link that's been shown across a number of different research studies that have occurred, and more data as it comes up, more and more data is confirming this as well, or supporting this rather. So in 2017, Fraser Health Authority released a report called The Hidden Population, and what they found was when they looked at the opioid overdose deaths, what they actually wanted to do was they didn't know what they were going to find. They just wanted to look at the overdoses and see if they could discern something, or see if they could find any patterns. And what they actually found was that 44% were employed at the time of death. They found that 55% at the time of death worked in the trades and the transport industry. So it's over half of everybody that died worked in the trades and the transport industry. They also found that about 80% of people actually had contact with healthcare services. And of those, almost 60% of people that died in the overdose from opioid overdoses had actually sought help for pain-related issues. And 77% had reported chronic illicit use prior to their death. In addition to that 2017 study, other studies have now come out and shown that construction workers are more likely to use opioids than other professions. There's a number of large-scale US studies that have identified the link between construction and overdoses. In Ohio, they found that if you're a construction worker, you're 7 times more likely to die in the overdose epidemic than any other worker in any other industry. Similarly, Massachusetts found that if you were a construction worker, you were you had a 6 times more higher risk of mortality in comparison to other industries. And the CDC also produced very similar results as well. They looked at industries as a whole, and what they found were that the construction and extraction industries had the highest proportional mortality rates. So we are seeing more and more data that is showing that there is a link between construction and the opioid epidemic. In 2019, CERP, which is our program, that's the acronym for Construction Industry Rehabilitation Plan, we contacted WorkSafe BC, and we wanted to try and understand what was going on. We wanted to try and understand, you know, why we were seeing such high rates of substance use, such high rates of mental health, and why we were disproportionately losing our men and women to the opioid epidemic. And so we contacted contacted WorkSafe BC, and we worked with them on a really robust, large study. And so we partnered with WorkSafe BC to understand what would motivate someone, or indeed not motivate someone, to seek help within our industry. Why is it that people are dying in the opioid epidemic? Why are they not coming forward? We also wanted to understand what the industry's attitudes towards mental health and substance use was, both from the employer's perspective and from the employee's perspective. So we undertook an environmental scan of men and women from across Canada, and a whole large number of people from within unions, non-unionized, and other sectors of the construction industry were interviewed. And what we found was that the results showed that when people were struggling with mental health and substance use, folk were not even sure whether or not they actually had an issue. And so this was something that was quite, I've got to be honest and say, from our perspective, from the program, bearing in mind that we do have a skewed population, we're working with folk that have mental health and substance use. They've already come to us, but that finding didn't surprise us, because one of the things that we hear all the time on our program is that men and women within the construction sector, they have this saying, and I'd love to hear what members of the audience think here, but we have this, I hear often about a work hard, play hard culture. And that's actually something that's come up in another study that we did with Fraser Health as well. Very similar results came up where we had construction workers saying, well, we work hard and we play hard. And so there's this culture that exists. And so because of that culture, what we found in this WorkSafe partnership was that folk didn't actually know whether they had mental health or substance use issues. And the reason they didn't really understand whether or not they had a substance use issue was, you know, when they looked to the left or they looked to the right, everybody was using, and they're all using more or less the same amount. And so, you know, is what I'm using problematic, or is it a normal amount? And so this was a problem amongst some of the folks that we, in fact, it was a big problem among a lot of the folk that we interviewed. When folk did know, or they suspected that they might be struggling with substance use, they had a real fear of disclosing this issue at work. They really did fear losing their jobs. And again, I think the panelists before me have really kind of touched on this issue of stigma. And stigma, it's real. It's real to the point where it is actually lending to some of the numbers that we see. People are dying because they are just so afraid of coming forward. And while the results showed that both mental health and substance use were difficult subjects to broach within the workplace, discussing substance use was significantly more challenging than discussing mental health issues. And so again, I don't know that surprised me. That's something that I think over the last 5 years or so, again, I've worked in this industry for 20 years, almost 20 years, and I can tell you mental health has been stigmatized throughout, as has substance use all that time. There's always been a lot of stigma. But in the last 5 years or so, what we've noticed is that we are talking about mental health a lot more than we ever have today. The number of panels and presentations I give today is exponentially higher than I've ever done in the past. So whilst both are difficult to talk about, substance use still remains really, really difficult to talk about. One of the quotes that I always remember from this study is a gentleman had, in describing what it felt like to have mental health and substance use issues within the industry, he described it as a fire in a dumpster. You know, everybody knows there's issues going on. People know that they're struggling with this, but they put the lid on it because nobody quite knows what to do with it. And also, if somebody does see that fire, then there's going to be, you know, all hell breaks loose. So it's really difficult to talk about. The other thing that the study showed is that employees are different, and this is really key. And I think any time we look at interventions, this is incredibly key. It showed that employees are different. They have different levels of education, they have different experiences with substance use or with mental health issues, and they also have different cultural views on both of these. And so because of this, they are looking for a wide variety of resources. They're looking for a wide range of solutions. It's definitely not a one-size-fits-all, but definitely not. So again, I think we've touched on this earlier today, and that is that there is a link between stigma and overdoses as well. By far, stigma remains one of the biggest reasons why people continue to die from the opioid epidemic. There is a broad and widespread agreement that stigma contributes significantly to the opioid deaths. But why is that? Why do we have such huge amounts of stigma to what is actually a medical issue? And part of that is because research has shown that people with substance use, they're dehumanized just in society, in movies, in culture. They're very much dehumanized and they're seen as less important, mainly because addiction is seen as a moral choice rather than the medical condition that it is. And make no mistake, it is a medical condition. Addiction is has a physiological and a psychological basis in the human body, in our brains. It's also stigma is also perpetuated through language, and we have language that places negative labels on those with substance use issues. So you have labels such as junkie and crackhead, and again, you've only got to open up a magazine or a book, or does anyone open up books these days? I don't know, but you've only got to turn on the news and you're going to hear about junkies and addicts and very dehumanizing and stigmatizing language. Shame and internalization of the addiction. People themselves often feel a huge weight of shame and guilt when they are struggling with substance use. And there is often this misconception that people who use substances chronically must enjoy their lifestyles. Honestly, can tell you in the, like I said, 20 years of working in this field, I've never met anybody who enjoyed their lifestyle. They just haven't. In fact, most of the time I meet people that just want to make changes. Stigma also impacts how we conceptualize the opioid crisis as well. Our political views will dictate whether or not we support services that have been shown to save lives. One example of this is OPS sites, overdose prevention sites. So since 2016, when the pandemic began, there's been 2.2 million visits to the OPS sites in Canada. There's been 17,600 overdose reversals that have taken place in these sites. But even with those staggering numbers, I mean, that's huge numbers, 2.2 million visits, there's been 0 deaths. Not a single death has occurred at an opioid prevention site. But because of the stigma that exists, we only have 40 OPS sites in Canada, just 40. And I just want you to stop and think for a moment. If we had more than 40 OPS sites, how many more lives could we save? How many more lives could we save? And the reason we don't have more than 40 OPS sites is really because of stigma, and that's it. It really is. That's the main reason why we don't. So I think everybody's again already spoken about the fact that not only do we have the opioid epidemic, but then COVID hit. And when COVID hit, it had a devastating impact on an already raging crisis. There's been a disruption in supply, and Larry had spoken earlier as to why this had been disrupted. So I won't go into that. Borders are closed, and so the reason that we saw this huge spike in numbers, and we saw massive spikes in numbers, is because of the disrupted supply, people started concocting their own supply here locally. And so what happened is that we've seen these concoctions with all sorts of different animal medications being put in. And perhaps what's really worrying is we're seeing a real high number of benzos being put into the supply that's doing the rounds right now. And the issue with benzos is that naloxone only works on opioids. Benzos are not opioids. And so anything that has benzos, and there has been a huge increase of benzos within all of the, sorry, I should say benzodiazepines within the supply chain. So what's happened is when someone is trying to reverse that overdose using our #1 thing that we use to reverse opioids, it's not working. It's not working. And so that's that's another reason why we've had such a spike in overdoses as well. Conscious of time here, so I'm just going to whiz through this. So we are a joint union and employer program established in 1987. In 2016, we had an extensive redesign. I was brought in and we changed our previous model into a clinical model. We now deliver best practice services, and we have a 3-pillar delivery model with 4 goals. Our mandate is to provide mental health and substance use services to the members of the BC Building Trades and the Construction Labour Relations Association and their members. So it's a pretty, I'm always quite surprised, pleasantly surprised by this mandate. It's so inclusive, and it makes me very proud to be working here as well. So this is the program that we offer. So we offer a 3-pillar program. We have, within those 3 pillars, we offer programming under those pillars. So we've got prevention and promotion, we have treatment, and we also have building resiliency. Now, what I always say to my board, to members of the industry, is treatment is what everybody understands. That's the piece that everyone gets. It's when you go in, you do the residential treatment, you do the counselling, you do everything else that you do. That's the meat and bones. But one of the things that I always say is that where we really want to invest dollars is in the prevention and promotion and building resiliency. When we think of this purely as a business model, this is where we get our return on investment. When you protect the investment you've made in treatment, we've got to go with prevention and promotion, and we have to go with building resiliency. So within that, we do a number of services. So obviously one of the main, I'll talk about the treatment pillar first. So the first thing, primary thing we do is trauma counselling. We know that within our industry, over 90%, and I just want to really kind of emphasize that number, 90%, 90, people that come in have early childhood traumas, right? So they've experienced early childhood traumas. And of that 90%, 70% will screen positive for PTSD. So again, staggering numbers. Of the 90% that come in, 45% will have scored over a 4 on a standardized scale that we use. Now, when you score over a 4, you are 700% more likely to have a substance use issue. You are 1200% more likely to commit suicide. You are 400% more likely to have health conditions as well. And 45% of our folk are scoring 4 or more on that scale. So very, very high numbers that we're seeing. So we do the trauma counselling, we do diagnoses. Now we don't actually have, we're very, very small, this looks really big and comprehensive, and it is. We provide, you know, that intersectoral model of care, and what that means is we have these services, but we try and partner with community agencies to help deliver on these services, because we don't have the resources to do it ourselves. But we recognise that without all these core components, we're not really doing the job that we need to be doing. So we provide mental health management, we provide diagnoses in partnership with other folk. One of the things I really wanted to talk about today, and maybe I'll get a bit more chance later on, is the opioid-free assessments. So we are currently, in 2019, we piloted an opioid-free pain service. 77% of, the injury rates within construction are 77% higher than any other industry. So it's very high rates of pain within our industry. I think that's a given. We all kind of recognise that. I don't think anyone's arguing that. But the issue is that we work in a very safety conscious, safety sensitive industry as well. And so because of that, one of the things that employers and unions have been talking to me about for the last 5 years is that we need something as an alternative to opioids. We have pain, but we need something alternative. So we had been working for a number of years, listening to our community, listening to the unions and the employers, and we developed a program, a whole program around opioid-free pain service. And it was, I was very proud of it. It was a fantastic program. We spent a year developing it, so no opioids, but we had classes, we had psychology of pain classes, we had physiotherapy, we had restorative yoga, we had intramuscular skeletal needling, and COVID hit, and unfortunately we had to wrap it up. After a year of service, we only ran it for 3 months and had to wrap it up. But we are working with some industry partners as well and some community partners to see if we can get that running again. So the goals that we have as a program, the strategic goals that we have as a program, are to really reduce drug and alcohol related workplace incidents, to deliver mental health and substance use treatment that is timely and accessible to all members, and to build resiliency to reduce problematic symptoms of mental health and substance use. So some of the programs and initiatives that we're currently working on is we're working on, at the minute, developing a mental health literacy program. And this is an online library of resources and a program to help increase mental health awareness and to do some of that building resiliency that's part of the model of service that we have. The other thing we're looking to do is provide, it's an initiative called A Kit in Every Hand. So we truly believe that actually it should be a simple ask to have every single one of our members have a naloxone kit. We are a registered naloxone site, so it doesn't seem like it should be that difficult. And so we're currently working on, she says optimistically, but we are currently working on seeing if we can, this is an initiative that's ambitious, but something that we think is something we should be able to do. We are doing, we already do overdose prevention training, and as I said, we've developed the opioid-free pain service that we're again looking to deliver on that again. We do online counselling, but we've always had online counselling. We've had this way before COVID. We are expanding our evening appointments, and we do have online groups as well. So part of the initiatives that fall under the building resiliency is we have what we call stress inoculation workshops. These are embedded into apprenticeship programs. So we provide education and coping strategies around stress. And we run that through a number of different apprenticeship programs, but we're looking to expand that and to deliver that to more of the apprentices as we go on. The other thing we do is provide industry training and education on mental health and substance use. So if you, an example of some of the types of trainings we might have done is this kind of thing. So a mental health and substance use primer 101. We also do how to spot signs of mental health in the workplace and what to do. We've gone in and spoken to frontline desk workers who are taking calls from industry members who are calling in suicidal, and kind of teaching them about suicide awareness, how to manage a call that comes in from someone that's suicidal, and where to refer them. And so we do a whole number of different workshops on a whole variety of topics as well. I rushed the end there a little bit. I was mindful of time, but that is it. I've got my contact details up there if anybody does want to drop me a line or give me a call. I'm always happy to talk about mental health and substance use. Anytime I can do that is a good day.
Thank you very much. Great presentations we've had. We've got lots of questions and not a lot of time, so I'll get right into it with a couple of very specific questions. The first one that I received is one of the ones we hear quite a bit. Many people think this is a downtown east side problem, and that this is not a problem anywhere else in British Columbia. If it is, it's minor. Can any of you comment? Let's start with the politicians, and then we'll go to the Labour rep here.
Yeah, Ron, you're quite right. This is in every community. It's urban, rural, and as the numbers very clearly show, the majority are people that have jobs and are housed. So we have, like a lot of other things, there is visible addiction and there is invisible. And those of us who get to have a glass of red wine on our back patio, no one's gonna look at us sideways. So it's a major part of the stigma conversation we need to talk about. We need to keep saying those stats. This is about our own families. Mothers Stop the Harm are an amazing group talking about this. Women who have lost particularly their sons, and they just talk about it in such a real way. It really does change minds.
I just want to bring Harwinder into this because from Vernon, again, nothing like this happens in Vernon, right? everything is fine. So can you comment on the Okanagan situation or more rural BC?
Yes, Ron, absolutely. It's unfortunately big problem for Vernon and in the Okanagan. And I'm sure that in every community, years ago, I lived in Northwest BC and same problem. Some communities have it on bigger scale and it's ongoing, and it's the problem that was ignored for years. And again, working in healthcare at the hospital level and in community, and you talk to other colleagues who work from outreach clinics, it's, and a lot of people think that, you know, it only exists or only certain group of people are addicted. This is every class, every socioeconomic background. Some are hidden, some are not coming forward, and unfortunately many parents find out when they lost their child, or family members find out because of the stigma that's attached. And sadly, sometimes we live in this false sense of that class, and that a lot of people from those socioeconomic background don't come forward because it's stigmatized. And then mental health, and when you talk to working in healthcare, most of these people, it's not that they grew up with the dream that I'm going to grow up and be a drug addict, or the parents didn't raise them that. There's a lot of mental health and trauma, childhood trauma, abuse involved, and it's just heartbreaking. And when you see society, whenever their actions are taken from government level or any aspects, and a lot of people in this society just say, and they openly say on internet, as a healthcare worker and advocate for mental health and substance issues, it breaks my heart when they say, why do we need to spend this money on these people? Why do we need to provide kids? I just like to request to those people, think about if they were your children, or they are somebody's babies, and they somebody's loved ones. So it's a big problem. I've been advocating, hoping for more resources, which I'll be asking Minister Malcolmson later to have more, maybe treatment centers, or even one nice one in the Okanagan in every area, because right now, sometime working in healthcare, there is desire that they want to quit, and by the time they're waiting, because again, this was neglected for years, then, you know, they just fall back. So absolutely, it's everywhere, in every culture, every class, and every socioeconomic background.
Thanks. Vicky, do you find this, you know, in construction industry, do that it's province-wide?
Not only is it province-wide, it's globally. The research that's coming through is showing that it's not just province-wide, it's not just Canada, it's not just North America, this is across the globe. We see very similar results in the UK, in Australia, in America, in Canada. It is across the board, we're seeing the same thing. So it's not just province-wide. I just wanted to add a little bit more to Harvinder, what you were saying there. One of the other things that's really problematic is that not only is it, there's a lot of stigma, certain cultural groups have even greater stigma. South Asian population, for example, within the South Asian population, we know that there are very high rates of overdoses occurring, but no one's speaking about it. And part of the reason is this huge shame, right? So what you'll hear within our communities is you'll hear people say, oh, he died of a heart attack, or he died of you know, something else. They just won't say it's an overdose, or they won't say there's a substance use issue. Now, part of the reason, about a year ago, I did, along with the previous Minister Darcy, we did a South Asian event here in Surrey. And I was presenting and doing some work around that. And as I was doing my research, one of the biggest thing that came out was that actually some cultures don't even have words for mental health. So within our South Asian culture, there are no words to describe mental health. So what happens when you have an absence of language is people apply stigmatizing language. And so that in and of itself is a huge barrier that contributes to that stigma. And unfortunately, unless there is some work done around development of language within our South Asian culture, that stigma will remain, because there is simply an absence of language that is contributing to some of this, some of the stigma that's happening.
Thank you. I got one of the questions. I'm looking at various devices because I'm getting questions that are on every one of my devices here for you folks. A very specific one, probably mostly for the minister here. It said, Surrey's had a recent uptick in overdoses due to the fact that dealers were cutting fentanyl with benzos. It would be a great help if the drug users were able to test their product. Are there any plans in place to do something what's done in Insight, which is an ability to test drugs for the Surrey-Langley area, and a safe needle exchange as well for that area? There are a number of questions that come from people specifically from that part of the province.
Yeah, for sure. Yeah, the numbers have been terribly high. I'm really pleased, in reference to Vicky's point about South Asian community. I'm really encouraged that we've got a lot of new translated services, both for mental health and overdose awareness. That's a new innovation and vitally necessary. So my big picture answer to a lot of those specific, will this service be available in this region? It all points back to the health authority. So extremely helpful for the health authority to hear from people in those communities about the service that they need, and to help stand up some of the service providers that are doing the work. So what we're doing through our overdose emergency response committee, it's doing the on-the-ground work with the service providers, the activists, people who use drugs, their families, identifying what the needs are. We are funding the activities where there is a credible service provider and that the health authority kind of comes in and asserts, yes, that they think that that service is needed there. And then, in my area, Island Health, they'll work together to find siting, and it's very cooperative, as it should be, part of our healthcare system delivery. But any of those specific needs, needle exchange, drug testing, it'll be generated within your region, and health authorities and the service providers, if they support the idea, then we are funding a whole bunch of this work.
I'm going to try and squeeze in one more question, but Vicky, go ahead. You wanted a quick, short snap?
Sorry, I was just going to say, if somebody is looking for one, all you've got to type in is drug testing, Surrey, and you'll come to the Fraser Health website, and there's a page that lists absolutely every drug testing facility they have. And there's a really long page of resources there.
Yeah. Awesome. Thanks. We have time for one more, and this has come up a couple of times, and I'll paraphrase what some of the questions are. How can we make workers' compensation or WorkSafe regimes across the country, but also in BC, more responsive to addiction problems among workers? And I'm going to start with Vicky on that one.
Yeah, this is a question that I've asked, thought and spent a lot of time thinking about. I think within the industry, we do have, one of the issues we have is a quick fix mentality. We need something that fixes it quickly and get back to work, and that's where the pills come in. The actual resources or the interventions that we actually need take time for healing. So when you're looking at soft tissue damage, you're looking at a good few months before somebody goes back to work. Now, it's almost like we're in a perfect storm here, because not only do we have the opioid epidemic, we have this culture of a quick fix. We need people to get back to work quickly. We're also in the middle of a shortage, right? So there is a real shortage of workers. And so all of that collectively means that we are sending workers back. What we actually need to do is actually slow it down. How do we do that? We need more apprenticeships. We need more people coming into. We need more initiatives to get people in, so that we can move away from this culture of where we are desperate for workers, and we're desperate, for Johnny's hurt his back, and we're desperate for him to get back because all of our other projects are now slowed down. And then coupled with that, we need to work on these opioid-free responses as well. Like I said, we developed this whole program, and really we had some amazing results when we first started this. So we need alternatives to opioids, and we need a cultural shift. We need to work at changing this culture of taking a pill that fixes or masks the pain, because it doesn't actually fix anything. All it does is mask. So we need to kind of move away from that culture, but that's not an easy thing. There's a whole number of different variables that factor into that.
Thank you. Let both of our other panelists respond quickly to this one about WCB. We'll start with you, Minister.
Yeah, just again to reiterate, the assignment that the Premier's given to me and Minister Harry Baines, does get at what can we do at a systems level to address the pathway from pain to addiction. Harry's been doing a lot of work already on WCB and WorkSafe. And it had been so neglected for such a long time. There's absolutely more to do. So, we'll be looking forward to a partnership with the labor movement to send us in the right direction. We'll be drawing on your advice, and it's just so encouraging for me to hear more about the work that construction trades are doing, and the leadership that's exhibited through Vicky's work is really helpful for me to learn more about tonight, and look forward to hearing and learning more.
Absolutely.
Harwinder, last word to you, Harwinder, and then I'll pass it on to Orion from our office.
Yes, I would reiterate that focusing on prevention, and when we identify that it's prevention is too late, then providing the resources and all the extra supports that need to deal with the situation or treat those people. And again, there could be multidisciplinary approach, whether it's counseling and having any support, destigmatizing. And I believe that when we invest more on prevention and early detection of problem, it ends up that it's the best investment. And when right now we are, yes, the problem was neglected for years, and I am so grateful to the work that was done in the last 3 years. And I have witnessed having mental health substance use teams when I had a patient I need to refer. Before we had nothing, and then now we have outreach clinics, harm reduction sites, and whatnot. And that's just the beginning. More needs to be done. But workers, I'm pretty confident that Minister Malcolmson and Minister Baines will continue doing the work that they've been doing and growing on, that success that we have somewhat, and to work with workers' comp to address these issues. Again, we are in the Band-Aid fix mode right now, and people who oppose these ideas of investing in such services don't realize that when we do the Band-Aid fixes, we end up spending a lot more money. And really money shouldn't matter when it comes to save lives. But if people, some people like to think from that lens, that they need to think that when we focus more and put money and resources in prevention and supporting people when they're already there, it is the best support we can provide and best investment to help them.
Thank you very much. I'm going to turn it over to Orion Irvine, our regional director, but I learned a lot in this panel myself. Thank you all, and we'll see you at Harrison next year. Orion.
Yeah, so thank you very much to the panel members, the minister and the MLA and Vicky. I think it's wonderful that you could come out and talk about this issue, and it's very important. I think you all gave a great deal of insight that a lot of people, as was mentioned, thinks this problem that affects, it's a moral failing, and it's not. It's a healthcare issue. It's no different if you were to have diabetes or cancer. It's just a healthcare issue, and we need to address it as that. And if we don't, we're going to see many more people continue to die at a much faster rate. So thank you very much for taking the time. Thank you to all the participants that came out and talked about this issue. I hope you can think about how your union can help out on this issue, whether it's talking to the government and supporting them in their initiatives, or talking to folks like Vicky who are working with unions and employers on bringing some programs in to help not only our members, but all workers and everybody across British Columbia. So thanks again for coming out, everybody, and look forward to seeing you all in person at Harrison next year. So have a good evening.
Thank you.
Thank you so much.